Leonardo Aguiar from South Brazil, from Santa Catarina, Brazil.
Good morning, ladies and gentlemen. First of all, I'd like to thank all the coaches. I'm really honored to be here. My name is Leonardo Aguiar. I'm from Blumenau, in Brazil. And today I'm going to show you my view about how we can reinvent medical practice through innovation. I have nothing to disclosure. The way we connect information, we create knowledge. And the way we connect knowledge, we create concepts. And today, I hope I can bring you some new concepts. Those concepts from Singularity University. This university was co-founded by those companies and is based in Mountain View, California. And we have the main purpose to create global impact. And global health is one of our programs. And Future Med is one of our global health programs, which has the main purpose to inspire all global thinking leaders to collaborate in cross-training from medical intervention to medical practice. And in medical practice, I was one of them. So what's Singularity University mission? My mission today is to educate, inspire, and empower leaders, you guys, to apply exponential thinking to address global health challenges, to address medical practice and plastic surgery global challenges. So let's talk about exponential. If you take 30 linear steps, you reach 30 meters. On the other hand, if you take 30 exponential steps, you turn around Earth 26 times. So let's apply this on the business model. Do you remember Kodak Company with its linear business model? In 1996, worth $28 billion with 140,000 employees. And 6 years later, worth less than 100 million with 17,000 employees. In the same year, Instagram, with its exponential business model, was sold by 1 billion with only 13 employees. And last year, WhatsApp, with only 55 employees, was sold for 19 billion. What those companies have in common, besides exponential thinking business model, they have plurality and collaboration. You can see Brazilians, Americans, Turkish, all day together, changing information. More than 90 presentations from 16 different countries, 16 different backgrounds. This makes ABAM a plural meeting. And the way our co-chairs conduct this meeting inspires collaboration. Not to mention the ABAM social. That's why, in my humble opinion, plurality and collaboration makes ABAM 2015 the best meeting of this planet. And the secret of ABAM is the combination between collaboration and plurality. And in Portuguese, we have a very unique expression for this. We call tamo junto. So this red line represents linear way of thinking, and the yellow ones represents exponential. And the gap between those two lines, some people call disruptive stress. For me, it's opportunity. And regardless of ABAM's excellence, in terms of exponential thinking, we are just starting. Have you ever felt disruptive stress? My dear colleagues, have you ever felt that? This mHealth PwC report shows us really interesting things. Show us that patients really want convenience and control, but doctors are resistant to this loss of control. Roughly 50% of the patient thinks that mHealth will improve the cost, quality, and convenience of their healthcare in the next 3 years. But 6 in 10 doctors think that it will take much more time because they say that there are improvements in business models. We are talking about disrupting business models. We are talking about reinventing medical practice. I am talking about generating health data. I'm talking about using this data to promote health, to use disruptive stress as an opportunity. Most medical business models are disease, procedures, or volume-based models. And so how can we disrupt this model? We have to change this curve to the left. We have to change our mindset from disease, procedures, and volume-based models to a mindset focused on promoting health models. And how big do you think are these disruptions? Some people say it's $1 trillion disruption. And how can we achieve this $1 trillion disruption? Just by following these three simple concepts: patient-centered care, consumer engagement, and science of prevention. By using these concepts, we can create the companies of the future. Because 75% of the 500 biggest companies do not even exist. We are about to create them. And most of them will be healthcare companies. Do you believe me? Google, Apple, and Samsung do. And they're working really hard on it. So hard that Google created Calico, a company with the intention to solve that. And also with Apple with their trackers and the apps. So how can we get back to the game? Let me tell you one of my favorite histories. This is Laura, my patient. He went to my office asking for a tummy tuck. And as a young plastic surgeon, what do you think I told her? I told her, no, the knife is not the best solution for you right now. Usually, the body unbalance is caused by inner disbalance with external manifestation. And instead of surgery, I suggested her another technique. I suggested her co-creation. Co-creation is a buzzword which means active client participation on the process of elaboration and of creating products and service. So, I want to tell you and show you how Laura became like this without any kind of surgery. First of all, we created a specific team for Laura's real needs. A team composed by me as a plastic surgeon and a life coach, commanding this team, and a personal trainer, and an esthetician, a nurse, and a nutritional consultant. This team was a plural team with a collaborative mindset, with a design thinking mindset. And this team, under Laura's command, co-create a specific process for Laura's real needs. And with this process, she started running, started eating healthy, started inspiring her friends, and soon she became a new woman. And 7 months after, we worked so hard on her autonomy and her self-esteem that, do you remember, Laura? She became another woman. And by the end of this whole process, she still needed the abdominoplasty, and we performed on her the abdominoplasty. But it was a surgery with a different purpose from the one that she thought when she first met me in my office. And this beautiful, plural, and collaborative process we call co-creation of health. By doing the process, Laura was so motivated that she also created her own Facebook page to inspire and motivating others. And to motivate her even more, I challenged her. I told Laura, I challenge you to complete a 10K run with me by the end of the year. And Laura accepted the challenge. And one day, I read a post that she wrote, and it was written like this: today, I'm really, really happy because I just finished my 7K run, and in a few months, I will be running 10K with my plastic surgery. When I read that, I thought to myself, oh God, what I have done. At that specific moment, the longest I ever run was 6K, and Laura did 7 already. Literally, I had to run after her. It was a tremendous exercise, an exercise of humbleness. I had to run and learn with my patient. And then some few months later, me, Laura, and another co-creative patient, Viviane, finished our first 10K run. And last week, Laura sent me another message. I don't want to pressure you, but I really run this week. And I just finished 12K today. And she even sent me her link with her stats showing 12K in 1 hour and 44. Inspiring me. So, I do respect enhancing self-esteem and treating disturbs of plastic surgeons. I do respect the potential of us as plastic surgeons to treating disturbs of the body of the people, of people's body, and enhance self-esteem of them. But I dream with our business models promoting health. One last thing, tamo junto. Thank you.
This is one of the brightest young minds in Brazil in plastic surgery. He came on the first ABAM right here in 2009 as a resident.
Yes.
He was still a resident in plastic surgery, and you could tell from his presentations he was just one of these special kids. So thank you for staying with this, and good luck.
Thank you.
Next speaker did Eric come?